So hello students, I am Dr. Pradeep Pawar, Professor of Anatomy. Now students, have a look at this. This is a very important topic, just have a look at this, a small topic here. Now, the moment we remove the pectoralis major, here, we have opened the pectoralis major here. We have removed the pectoralis major, and deep to the pectoralis major, there is a fascia. Look at this fascia. You can see this fascia. Where does this fascia begin from? It begins from the clavicle. Yeah, it begins from the clavicle and it goes and gets inserted into the axilla. So, this fascia begins from the clavicle, goes and gets inserted into the axilla, and this fascia is known as the clavipectoral fascia. Clavipectoral fascia. Where does it begin from? It begins from the clavicle, and where does it go and get inserted into the axilla? Now, this fascia encloses two muscles. Just have a look at this. It encloses two muscles. Yep. What is this muscle? A muscle which begins from the ribs and gets inserted into the coracoid process. What is this? Yes, that's the pectoralis minor, and it also encloses one more muscle. Look at this muscle, a muscle which begins from the first costochondral junction and it is inserted on the clavicle, on the inferior surface of clavicle. I just told you this. Subclavius, correct? So this muscle is the subclavius. This fascia begins from the clavicle. Now clavicle has got two borders. Just imagine this, if this is the clavicle, it has got two borders. This fascia begins from the two borders of the clavicle. It goes down like this, it joins below the clavicle. It encloses a muscle below the clavicle. What is that? The subclavius muscle. So it encloses the subclavius, joins here, now goes down, gets another muscle. What is this now? The pectoralis major. It again splits, encloses the pectoralis minor, and it gets inserted into the axilla. So this fascia encloses two muscles, one the subclavius and the second one is the pectoralis minor. Okay, fine, clear to all of you following this? Right. Now understand this, a very important thing. This part of the fascia, look at this part of the fascia between the pectoralis minor and the axilla. The part of the fascia between the pectoralis minor and the axilla, this is going to pull the axilla up. It is inserted into the axilla. It is going to pull the axilla up. And you know how the shape of axilla is. It is not flat. If you see the axilla, it's not flat. It's like a dome. It's a dome-shaped structure. So this fascia is going to pull the axilla up, and this is what we call as the suspensory ligament of axilla. Suspensory ligament of axilla. Clear? So what is the suspensory ligament? The part of the clavipectoral fascia between the pectoralis minor and the axilla, which is going to pull the axilla up. This is what we call as the suspensory ligament of axilla. Perfect. Now this part of the fascia between the subclavius and the pectoralis minor, this part of the fascia between the subclavius and the pectoralis minor extends from the costal cartilages to the coracoid process. Look, costal cartilages to the coracoid process, and this is what we call as the costocoracoid ligament. Costocoracoid ligament. So which are the two ligaments associated with the clavipectoral fascia? One is the suspensory ligament of axilla, and the second one is the costocoracoid ligament. Costocoracoid. What is costocoracoid ligament? The part of the fascia between the subclavius and the pectoralis minor, extending from the costal cartilages to the coracoid process, becomes thick, and this is what we call as the costocoracoid ligament. Perfect, students, perfect. Are you getting this? Yes, and the second part between the pectoralis minor and the axilla, it is going to pull the axilla up, and this is what we call as the suspensory ligament of axilla. I hope I'm clear about this. I'll just make a slide, students. I'll just make a slide for you. Have a look at this. Look, I'm taking a section. Okay, I'm drawing a section for you. Just look at this. Look at this. This I make as the clavicle. This is the clavicle. And this fascia begins from the two borders of the clavicle like this. It goes down, it again splits here, encloses a muscle here, it again goes down, and this would be the axilla. Right? What is this muscle here? Subclavius. And what is this muscle here? Pectoralis minor. What is this part? This is the costocoracoid ligament, and this is what we call as the suspensory ligament of axilla. I hope this is clear. Just go through this once. That's a clavicle. Perfect. That's about the clavipectoral fascia. Now you have to know what are the structures. This section we are looking from a side. So that's the clavicle, that's the axilla. This is the costocoracoid ligament. This is the suspensory ligament of axilla. This is the subclavius, that's the pectoralis minor muscle. Perfect. I hope this is clear. Now what are the structures which pierce the clavipectoral fascia? You can have a look at this slide. Structures piercing the clavipectoral fascia. One moment. Yep. So there are 4 structures which pierce the clavipectoral fascia. Students, can you identify this vein for me? What is this vein? This is the vein which runs on the lateral aspect of the upper limb. Yes, this is what we call as the cephalic vein. Cephalic vein. So the cephalic vein runs on the lateral aspect of the upper limb. The cephalic vein then lies between 2 muscles. What is this muscle? Pectoralis major. What is this muscle? Deltoid. Between the deltoid and the pectoralis major, you get a groove here. Yes, that's the deltopectoral groove. The deltopectoral groove. A very important MCQ, students. Who lies in the deltopectoral groove? The cephalic vein. The cephalic vein lies here. The cephalic vein now pierces the clavipectoral fascia. It pierces the clavipectoral fascia. It opens into axillary vein. It opens into the axillary vein. Is this clear? So the first structure piercing the clavipectoral fascia is the cephalic vein. Cephalic vein. Now second, you can have a look here. So that's the cephalic vein. You can see an artery here. Yes, any guesses? Any guesses? Which is this artery which is going to pierce the clavipectoral fascia? Yes, this is known as the thoracoacromial artery. Thoracoacromial artery. And students, what is this thoracoacromial artery? It is a branch of axillary artery. It's a branch of axillary artery. The second part of axillary artery. It's a branch of second part of axillary artery. That's the thoracoacromial artery. Okay. Third is a nerve. You can see this nerve here. That's the lateral pectoral nerve. Lateral pectoral nerve. And the fourth is lymphatics from the breast. Lymphatics from the breast. I'll just write this. Structures piercing the clavipectoral fascia. A very, very important MCQ for you students. Structures piercing the clavipectoral fascia. That's the cephalic vein. Thoracoacromial artery. Lateral pectoral nerve. And the fourth is lymphatics from the breast. Lymphatics from the breast. Is this clear, students? That's about the clavipectoral fascia. Have a look at this MCQ. Okay, just go through it. So students, while approaching the axilla, the surgeon reflects the pectoralis minor to find a fascia lying deep to it. Yes, that's the clavipectoral fascia. He identifies it as clavipectoral fascia. Following structures pierce the clavipectoral fascia except Yes, so what is the answer for this? Except the medial pectoral nerve, right? So the medial pectoral nerve does not pierce the clavipectoral fascia. Students, the medial pectoral nerve is going to pierce what? Yes, it pierces the pectoralis minor, and then it goes and supplies the pectoralis major, right? So the medial pectoral nerve pierces the pectoralis minor. Structures piercing the fascia would be 1, the cephalic vein, the thoracoacromial artery, the lateral pectoral nerve, and the fourth is lymphatics from the breast, lymphatics. I hope this is clear to all of you.